Hello everyone, my name is Pooja Pandita and I've done my master's in medical microbiology. And from the past 1.5 years, I've been associated with academic writing and academic research, helping students overseas. Today we'll be discussing a very interesting topic, which is based on exercise for fall prevention. It is basically a literature review. So literature review is basically a collection of all the collection of summary of all the published literatures on a very particular topic, and in this case, which is exercise for fall prevention among the older populations. So to begin, we'll first discuss why there is a need to change the interventions. For example, if there are current interventions, even the pharmacological as well as the pharmacological, why there is a need to shift our focus towards exercise for reducing the risk of fall among the older population. As we know that individuals beyond 65 years of age are more susceptible to falls due to their diminished mental capacities and existing comorbidities. Comorbidities can include cancer, diabetes, arthritis, and various other underlying illnesses which can contribute and increase the physical as well as mental health burden of the older population. Falls among the older population is a major cause of death, and if not managed and identified on time, can lead to serious complications. The proportion of falls in Australia reaches to 832 in 2017 for almost every 1 lakh individuals. The fall in most of the cases are connected to diminished mental capacities, which bring loss of confidence and self-viability. So there is a need that the healthcare professionals, including the nurses, need to shift their focus towards the non-pharmacological intervention and design a specific intervention for ensuring the safety of the older population. They can include their critical practical knowledge in an extended way to reduce the causes of falls among elder population. So we'll discuss in this slide what exactly is the scope of non-pharmacological intervention. Increasing age is a natural phenomenon. It means the age and aging is a natural phenomenon and that we cannot control it by any means. And this will eventually impair the anatomical as well as the physiological abilities of the older population. The major health risks associated with fall will include brain injuries, physical fractures, and even death. And it is also leading cause of mortality and morbidity among the older population. And therefore, there is a need to design a non-pharmaceutical intervention, and the nurses must also intervene and include their clinical practice to design effective interventions. The pharmacological approach, the existing pharmacological approach for managing the fall incidences will provoke the risk of polypharmacy, as well as adverse drug reactions. Adverse drug reactions can include headache, nausea, vomiting, abdominal pain, and various other factors. These all adverse drug reactions will exaggerate the existing illness and increase the existing comorbidities. Therefore, there is a need to shift the focus towards non-pharmacological intervention. So if we will discuss that exercise, then why exercise? Why the nurses or the healthcare professionals will shift their focus towards exercise, and how exercise can prove to be an effective intervention. So exercise will manage the pain. First of all, the pain due to the underlying illness is a serious and nursing priority, and therefore the first benefit of the exercise is the exercise can manage to help pain, and it also helps to increase the muscular strength. It will eventually perk up the mood and stimulate a positive attitude among older patients. So the next benefit will include activating everyday activity, which is an essential component among older persons to commence the treatment process. And exercise in this case will focus on assessing the barriers and then performing general mobility and other activities. Exercise can also improve beneficial by helping everyday activities like getting up from bed, eating, going to the washroom, by reducing pain due to the existing chronic illnesses. So exercise will not only improve the physical health of the person and will provide and make them be able to ensure their everyday activities, but also perk up their mood and improve their psychological health as well. And therefore we can say that exercise is a best and can prove as an effective non-pharmacological intervention for reducing the risk of falls. So for this literature review, what can be the research question and how PICO question will be designed? So the research question will focus on how exercise can prevent the risk of falls among older persons. And for the PICO question, the population will include older persons and the intervention will be the exercise. The comparison with control group where the risk of the falls will be moderate. And the outcomes will be reducing the pain and improving the mobility among the older persons. The study types will mostly include meta-analysis studies and randomized control trials. So what will be the inclusion and exclusion criteria for this review? So for the inclusion criteria, the researcher will only include the studies which have been published after 2016 and the articles which are relating to the topic or the abstract of the research. For example, exercise, reducing the risk of falls among older persons, that is the topic, and the articles should relate to this topic. And all the articles that are written in English language will only be included, other than English will be excluded. And all the papers that has been published in Medline and PubMed will be included. And on the other side, all the opposites of the inclusion criteria, for example, the studies which are published before 2016 and the topics which are not relating to the abstract and which are written in other than English language and not in the Medline and PubMed will all be excluded for the from this review. These inclusion and exclusion criteria must be followed by the research in order to gain an access towards the credible and reliable literatures and to gain an information that can increase the credibility of the current study, which is based on exercise for reducing the falls among older persons. So the next slide will discuss how exactly this exercise can be used as an intervention. First of all, the researcher will include the participants who are above 65 years of age, because at this age the maximum risk of fall can be seen in this age group. And the study will involve the non-pharmaceutical approach like exercise. And by conducting the study, it will be evident that the exercise will prove beneficial to improve the mobility and balance as well. Participants will be separated into two groups. The first will be the test and the other will be the control. The test group will show an effective response and the number of falls will also be reduced. However, on the other side, the control group will be a group of people who shows moderate response towards the exercise. And the maximum time for research will be 6 months to attain the better results of the intervention. So exercise will be provided to all the persons who will be aged more than 65 years of age and in two groups, including the test as well as the as well as the control group. So after identifying all the literature data and summing up the data, a few themes will be concluded in terms of outcomes and can be explained in this particular slide. So the first literature outcome will be based on effective reorientation strategy. It means that exercise can increase the muscular strength of the persons as well as it can be proved as an effective reorientation strategy to minimize the risk of falls. One of the studies concluded that exercise used to prevent fall incidences, in which reorientation strategy proved an effective assessment tool to evaluate the fall incidences for improved safety and well-being of the older persons. So this particular strategy can also help the researcher to identify and evaluate the risk of the fall incidences for the improved safety of and the well-being of the older persons. This will benefit the patient as well as the family members, because if an older patient is suffering from his experience continuously falls, the family members will also be affected, and they also had to ensure 24 hours safety of the patient. And therefore, by ensuring and by implementing this intervention, the falls will be reduced. The patient will receive the benefit, but at the same time, the family members will also be relieved, and the overall quality of their lives will be improved. The intervention helped to improve the walking time and balance coordination as well. So this is a very essential benefit of this reorientation intervention, which will improve the walking time and also ensure that the balance of the coordination of the patient is also improved. So the next literature outcome is based on educated healthcare nurses for improved care. Skilled nurses will use their critical thinking and decision-making skills to improve the patient outcomes by introducing effective care interventions. It means that the nurses need to be enough competent and introduce all their skills based on critical thinking and decision making to ensure that the safety of the patients is being managed, and by thereby introducing effective care interventions. Proficient nurses will also be able to aware of the ill effects of the falls. It means they will be aware that the fall, if there will be repeated fall, it can increase the risk of fractures and injuries of the head, and thereby increasing the risk or mortality risk among the older patients, and the competent nurses will be aware about this situation, and thereby which can increase the health risk and can also at the same time increase the participation of the nurses towards this intervention for the safety of the older persons. Training, education, and evidence-based knowledge play an important role in providing lifestyle improving strategies like exercise for patient well-being. So it means that the nurses are trained enough and so that they can apply evidence-based knowledge that plays an important role in increasing and shifting the focus of the older persons towards improving their lifestyle as well as improving their mood by the help of the intervention exercise. So competent nurses can deliver the best exercise. They can also coordinate with other healthcare professionals like physiotherapists and can design effective exercise plans. For example, at least 30-minute exercise every day will ensure the safety and improved mobility of the older persons. So still there are a few research gaps which were identified while conducting this literature study, and this particular slide will discuss the research, what all were the research gaps of the study. Firstly, the lack of evidence, effective use of standardized statistical tools. It means the use of statistical tools, for example, ANOVA and pre and post observational study tests were not included to gain an access towards a statistical increase or decrease in the fall among the older patients. So the lack of statistical tools is one of the research gap. Second, the bias assessment in data collection. The researcher did not mention whether he kept himself anonymous while collecting the data, and which could have dissolved the risk of bias while collecting the data. So this is a very essential and important part which can be included as a research gap, and thereby minimizing the credibility as well as reliability of the study. Lack of pre-assessment of illness. For example, if your patient is already having arthritis, this person will be more susceptible towards falls. So this group of population should not be included in the study because it can compromise our results and also minimize the credibility and reliability of our data. That's why the pre-assessment of the illness is also not done by the researcher, which creates a research gap. Or moreover, the budget limitations and the non-competence by the participant is also an evident research gap, which was not ensured before starting the study. So this is also an essential research gap, and which should not be present while conducting the study. So what all can be the recommendations for improving the study reliability and credibility, and can be improved in future studies as well. For future studies, a more calculative approach can be measured to quantify the role of exercise to minimize the risk of falls among the older persons. Some participants were not provided exercise according to their preference and therefore may not comply with the intervention. So consent is very essential. In consent, the researcher will explain all the steps that are going to take place while conducting the study, and what all are the steps that the participants need to take while being a part of the study. So after explaining all the steps, the researcher can gain an access whether the participants are actually preferring to participate in this study or not. So consent is a very essential requirement along with the bias assessment. Bias assessment should also be done at the time of collecting the data to increase the study credibility. Along with these two basic recommendations, the budget and financial resources must also be predefined. It means the budget and financial resources should be preset before initiating the study in order to complete the study in a timely manner, which will also simplify and credible the data received from the intervention. So to conclude, we can say that older persons are at risk of fall owing to their poor muscular strength and balance. Lack of exercise can trigger various fall incidences, and a lack of exercise can also lead to recurrent fall incidences, which is a leading cause of death among the older persons. There are various pharmacological interventions already present for supporting and minimizing the risk of fall, but those pharmacological interventions were associated with polypharmacy as well as adverse reactions, and therefore there was a need to design a non-pharmacological intervention which is based on exercise to increase muscular strength and minimize the risk of falls. So this exercise will improve the balance with no related negative effects, and can also improve the mood and the psychological well-being of the patient. Thereby, the exercise can show positive benefits and will create a effective and safe environment for the older persons, where the risk of fall will be minimized. So these were the references and resources which were used to design this presentation. So we can say that this presentation will surely increase the knowledge of the students in gaining an in-depth information about the benefits of fall as a non-pharmacological intervention for improving the overall well-being of the older patients by minimizing the risk of falls. Thank you and have a nice day.